First trimester screening, as the name suggests, is a screening process that we do in the first trimester of pregnancy. Now, what is the first trimester? The first 3 months of the pregnancy, as soon as the mother realizes she's pregnant, up till the 13th or 14th week of pregnancy. Now, this is the time the mother is full of anxiety. She's with a lot of questions as to whether my baby is okay, whether my baby is fine, growing well. So, in the first trimester, we do a scan around 8 weeks sometimes to see if there is one baby, two babies, or multiple pregnancies in case they have had IVF, that is test tube pregnancies, or in vitro fertilization, or if the baby is growing well inside the uterus or it's outside the uterus. Any other problems that they might have in early pregnancy, like pain or bleeding. In that case, we scan around, we do an ultrasound around 8 to 9 weeks and see if this baby is alive, growing well, if there is any other problems. At the same time, there is another scan which we do around 11 to 13 weeks of pregnancy, where we look at the baby on the whole, because by this time the baby is fully developed, fully formed. It hasn't grown up to its potential, but it's fully formed. So we do a screening in terms of whether the baby is at risk of having any genetic problems, because any baby, be it for a young mother or an old mother, has the risk of having a genetic problem, like a chromosomal problem. Most common of one of them is Down syndrome. So we look for certain things or certain markers in this baby around the 11 to 14 week scan, which can tell us whether this particular baby is at risk of having, or high risk or low risk of having, that particular condition. So along with certain markers, we look at the baby in the whole, we look at the development of the baby, we look at the blood flow of the placenta to see whether this mother can have any risk of high blood pressure or preeclampsia later in the pregnancy. So these are the things, a lot of things that can be judged or can be assessed in this window between 11 to 14 weeks of pregnancy, and we can give the mother a sort of a prediction as to how this pregnancy will go about, whether she needs to have extra care in the pregnancy, whether she needs to have early frequent scans, whether she needs to see any other physician, or whether she needs to be on any other medications to reduce her risk, or whether she needs to do any other tests. Along with the ultrasound, we also do a blood test, which is a part of the combined first trimester screening, as we call, which again gives an overall statistical risk as to whether this baby is at high risk of any chromosomal problem or genetic problem or any other issues. And depending on what the result of that test is, we can take it forward, whether the mother needs to have any other investigations, something called amniocentesis or chorionic villus sampling, which are diagnostic tests to confirm whether this baby actually has the genetic problem or not. So first trimester assessment of the fetus, starting from the time that 6 weeks or so when the pregnancy test comes positive, till about 14 weeks, forms a very, very important part of assessment of the baby, because this is where we can triage these pregnancies and put them as low risk or high risk, and then continue the pregnancy forward and reassure the mother that more or less everything looks fine or not. Thank you so much.